A new clinical case. A 67-year-old man who suffered from persistent infection visited his doctor. Linezolid as an antibiotic was prescribed for him. He used this antibiotic for long term. In his recent follow-up visit, his hemoglobin level was dropped from 14 to 9.6 grams per deciliter. Is there something wrong has happened? Is there any special relationship between long-term use of antibiotic like linezolid with anemia? Welcome to Blue Glass channel. Today we're going to talk about relationship between long-term use of medication, especially antibiotic, with anemia. So let's begin. Imagine taking antibiotics for weeks to treat an infection. Then your next blood test shows your hemoglobin has dropped. Is the antibiotic to blame, or is something else happening? The answer isn't as simple as you might think. Anemia simply means your blood cannot carry enough oxygen. It is not a disease itself. It is a sign that something is wrong. The challenge is finding the real cause. Can antibiotics really cause anemia? Yes, but it is relatively uncommon. Most people who take antibiotics never develop anemia. However, certain antibiotics and prolonged treatment can affect red blood cells in different ways. Mechanism number 1. Bone marrow suppression. Your bone marrow is a factory that produces blood cells. Some antibiotics, especially prolonged linezolid therapy, can temporarily slow this factory down. Fewer red blood cells are produced. Hemoglobin begins to fall, and CBC may also show low white cells and platelets. Mechanism number 2. Hemolytic anemia. In very rare cases, antibiotics can trigger the immune system to destroy red blood cells. This is called drug-induced hemolytic anemia. For example, penicillin, ceftriaxone, 2 examples of these kinds of antibiotics. Mechanism number 3. Folate interference. Some antibiotics like trimethoprim interfere with folate metabolism. Folate is essential for making new red blood cells. What tests help? Do not look at hemoglobin alone. Doctors often evaluate CBC, Reticulocyte Count, LDH, Bilirubin, Haptoglobin, Peripheral blood smear. These tests help determine whether anemia is due to decreased production, hemolysis, or another cause. Does every patient need to stop antibiotics? Absolutely not. Never stop antibiotics on your own. Your physician must determine whether the medication, the infection, or another medical condition is responsible or not. Most antibiotics do not cause anemia. Some can, especially with prolonged treatment. Always investigate the cause before blaming the medication. Lab tests tell the story. Thanks for watching this video. Hope it will be helpful for you. And if you found this video interesting, please give it a like and subscribe for more videos. And share it with anyone who is interested in lab reasoning. Until the next time, take care.